Methylphenidate is a medication that stimulates your brain and is classified as a CNS stimulant. It can be given to you to treat two conditions. One purpose is to treat a condition called attention deficit hyperactivity disorder, commonly known as ADHD. It is a neuronal disorder that impairs attention and difficulty focusing on a specific task. It may also be associated with hyperactivity. They may have restlessness, excessive talking, difficulty waiting, and interrupting others in conversation. ADHD is commonly observed in children. However, it may also be found in adults with growing ages. While symptoms of inattention are mainly observed in children, hyperactivity is more pronounced in adults. Methylphenidate can be used to modify neuronal activity and relieve symptoms of ADHD. Another use of methylphenidate is in the treatment of narcolepsy. It is one of the sleep disorders that makes you feel drowsy during the daytime. It is a chronic neuronal disorder that causes an imbalance in the sleep and wake cycles. Such people may have excessive daytime sleepiness that is suddenly induced. Few people may also have a sudden loss of muscle tone that lasts for a few minutes. Methylphenidate can be given to you to reduce sleepiness during the day. Methylphenidate is available in many brands like Ritalin, Concerta, Quilichar, Metadate CD, and many more. However, these brands are not equivalent in the release of medication. Even though all these formulations contain methylphenidate, they should be taken at different doses and strengths. Therefore, it is highly essential to know key facts about this medication before its use. In this video, we will cover a few things like how to take this medication, how it works, what is its effect on heart and blood vessels, when to avoid it, and what are common side effects. If you like this video, please don't forget to subscribe to our channel and hit the like button. Please share this video with your friends and family. Alright, now without any delay, let's start our discussion. How to take this medication. Methylphenidate comes in a variety of dosage forms for convenience in administration. It is available as oral tablets and chewable tablets. Both of these formulations have two variants: immediate release and extended release. Extended release preparations contain a higher amount of medication than immediate release tablets. However, the entire medication is not released immediately. They are intended for slow release of medication, supplying it into the body around 8 hours. Different brands release medications at a different rate. Therefore, it is always better to use the same brand every time to ensure proper dosing of medication. Extended release tablets should not be crushed or chewed. They should be swallowed whole. The right dose of methylphenidate depends on many factors, including the type of dosage form and brand you are using. Therefore, check properly the correct dosage form you are using. Typically, an immediate release Ritalin tablet can be given at a dose range of 20 to 30 milligrams per day initially. For example, a 20 milligrams dose per day can be given 10 milligrams tablets 2 times a day. These tablets should be taken 30 to 45 minutes before meals. Dose for children is still very low and properly adjusted based on individual factors. Your doctor will assess the symptoms of ADHD after a certain course of treatment and may stop therapy for a while to check any improvements. Dose may also be increased based on the response. Methylphenidate is also available as capsules, oral suspensions, and transdermal patches. Alright, let's see how this medication works. This medication increases a few chemicals in your brain that cause excitation. It inhibits reuptake of neurotransmitters like norepinephrine and dopamine. It blocks norepinephrine transporter and dopamine transporter at presynaptic neurons. This results in increased levels of these chemicals in the synaptic cleft that brings excitation. It is very interesting that this medication increases firing of a few neurons in your brain. This results in CNS stimulation. However, it is used in the treatment of ADHD, which is often linked with excessive firing of neurons. Therefore, methylphenidate produces a paradoxical effect in this condition. It may adjust neuronal activity and improve neuronal protection. However, being a CNS stimulant, it can bring many adverse effects on vital organs if it is not properly taken or used at very high doses. For example, it can reduce threshold potential and increase the risk of seizures at higher doses. Now let's see when to avoid this medication. Methylphenidate is not suggested to you if you have a high blood pressure and history of heart problems. It is also not recommended for people with glaucoma and adrenal tumors. If you have high thyroid activity, use of this medication may cause complications. In people with a family history of Tourette's syndrome that cause sudden muscle spasms, this medication should be avoided. It should be avoided in pregnant women. It is also better to avoid taking methylphenidate along with alcohol. Effect on heart. Use of methylphenidate can show an adverse effect on the heart. You may notice an increase in heart rate. That's why it is not recommended in people with a history of heart diseases like myocardial infarction or coronary heart disease. It can affect the circulation of blood, and you may observe numbness in fingers and toes. Even it can cause pale to blue to discoloration of toe and fingers due to poor blood circulation. However, if you observe serious side effects like chest pain, difficulty breathing, and fainting, immediately consult your physician. Effect on blood pressure. You can observe an elevation in your blood pressure with the use of methylphenidate. You may also notice an increase in heart rate associated with an elevation in blood pressure. Therefore, regular checking of blood pressure is highly recommended. Growth in children. Methylphenidate can affect growth in children. It may reduce the increments in height and weight that are normally observed with age. This effect is observed in children treated with methylphenidate for longer periods of above 1 year. Therefore, check the height and weight of your children on long-term use. Central actions. Being a stimulant, methylphenidate may cause a few abnormal sensations. Children may have hallucinations, either auditory or visual. They may hear strange voices or see a light coming toward them. They may also have delusions leading to wrong perceptions. It can increase a state of hyperexcitability and manic episodes. However, these conditions are more pronounced in the children with pre-existing psychotic disorders. Side effects. With use of methylphenidate, you may have increased heartbeat and palpitations. It can also make you nervous and have difficulty sleeping. A decrease in appetite may be observed that affects weight in children. You may have a few common side effects like headaches, dry mouth, abdominal pain, and sweating. Prolonged erection. Methylphenidate can cause prolonged erection in both adults and children. It may cause painful erection, and this condition is called priapism. Erection for prolonged periods can damage the tissue and be more troublesome. You can observe this condition during the course of therapy and even after its withdrawal. Therefore, take caution if you observe prolonged erections, especially if they are frequent. That's all about this medication, methylphenidate. Being a stimulant, this medication can affect many organs in your body. Especially heart and blood vessels are more affected. With proper usage at the right dose and duration, few side effects can be minimized. That's all, guys. These are the important facts that you should know before using methylphenidate tablets. Thanks for watching this video. Please share your experience and how it works for you in the comment section below. Have a great day.